Hi everyone, this is Tina again with Miraculous Medical Supplies Inc. CPR School, and I'm an American Heart Certified BLS instructor. And I wanted to teach you today, and it's always a good time to learn CPR. No better time than the present, because there's lives out there that may be in danger, and you are the one that may be ready and available and chosen at the proper time to help and assist. So I wanted to teach you today about the pocket mask and the bag valve mask and how to use that. All right, and as far as breathing. So notice the pocket mask. It has the rubber seal there, and it has a mouthpiece, replaceable. Okay, you want to give a good seal. You put it over in the triangle. Remember, the triangle goes up at the bridge of the nose. Okay, you form a C around the pocket mask, and you form an E. And you can grab the chin with the E and then the C, and you head tilt. We're head tilting, chin lift with the E, and then the C is holding it. So you want to make sure that the mask brings a good seal, that there's no air leaks around the mask. And we give 2 breaths. Okay, now that was really good because I saw the chest rise. There was no leakage of air. I didn't feel any or hear any leakage. Now, if you're delivering breaths and it doesn't go through and you don't see the chest rise, like this, check and see if there's an air leak, and maybe just tilt back the head again and chin lift, because the tongue could be obstructing. So you see the chest rise? All right, so we got the bag valve mask. This is used in every hospital, and also rescue uses this. And this is a reserve bag to deliver 100% oxygen, and also it's supposed to have a long tubing here, and you can connect that to an oxygen tank. Now it's the same thing with the pocket mask. You form the C and then the E. You head tilt. You can use your body. So you head tilt, chin lift, and you just give enough squeeze just to see, just enough for the chest to rise. Okay. Now the adults is 1 breath every 5 to 6 seconds, is about 12 breaths per minute. So we're going to air leak here. There you go, the chest is rising. Okay. Now if you're going too fast like this, you're going to hyperventilate the patient too much, and not only is the air is not only going into the lungs, but it's also going into the stomach. So what happens if you have too much air in the stomach? They're going to vomit. It's also going to not allow the lungs to expand to give that 100% oxygen, the oxygen that they need for their brain. So, and then you have complications of aspirating pneumonia and interruption of CPR. But if that should happen, if they do vomit during CPR, turn them over, try to clean out as much, and continue to do CPR and breathe. Now, when you're doing CPR, it's 30 compressions to 2 breaths for an adult, 2 inches deep, the compressions. If you remember the diagram of the heart, the atrium and the ventricles, there are veins and arteries. Veins are bringing back the blood into the heart, and the arteries and the aorta is pumping the blood out of the heart to the body. So we need to allow good compressions, but we need to allow the chest to recoil. So when we're going down, we are actually an artificial pump. We are pumping the heart for that patient. So we're pushing down, and we are pushing the blood out of the body. When we allow the chest to recoil, we bring our hands up. There's no pressure on the heart, and allows the heart to fill up with blood, so we can actually push it out again, fill it up, push it out, fill it up, push it out, and the blood is filling again. Don't be so hung up on the timing. Just remember that when you're pushing down, you also have to come up for the heart to refill. This is also an ambi bag. This is a neonatal ambi bag for the infants. And it's the same thing, the CE. However, on infants, we do not hyperextend their neck. And their trachea is cartilage mainly. And if we hyperextend, we just collapse their trachea. So we open the airway like a chin lift, but we have there in a sniffer's position where the nose is just pointing up when we ventilate them. So still the CE, and their breaths are one every 3 seconds. So they're about 15 breaths per minute. Okay, 15 to 20 breaths per minute for the infant, and 12 to 15 breaths for the adult. Okay, and remember, we don't ever hyperextend the infant's airway because we don't want it to collapse. And that is it on the ambi bag and the AED. If you like this video and continue teaching, we are so happy to teach and inform you about CPR because we're passionate. Our goal is to help people, care about people, and to teach and save lives. If you like the video, subscribe, hit the bell, and stay tuned for more.